Deciding how to feed your baby is one of the first big choices new parents make. Both breast milk and formula offer unique benefits. This video will explore the pros and cons of each, helping you make an informed decision on your feeding choices. Let's begin with the benefits of breast milk. Firstly, breast milk is highly nutritious and tailored, which means its composition is engineered to meet the developing gut and digestive system of the growing infant. Hence, it aids in easier digestion. Research also suggests that breastfeeding lowers cancer risk to a great extent. As breastfeeding burns a lot of calories, it aids in postpartum weight loss. It enhances bonding because of the skin to skin contact with the baby. It is free and is always available. Of all these benefits, there is one that is going to stand out. The breast milk is loaded with generational antibodies. Hence, it can boost the baby's immune system. When a person gets sick, the infection is fought by generating antibodies. Till the antibody is generated, the person has to feel sick. Now, when a mother gets sick of various infections, the antibodies are already there, and the generated antibodies are going to be passed on to the infant. So, most probably, the infant will not get the same sickness the mother had because the antibody is already present in it. Now, if you are breastfed, you're not only getting your mother's antibody, if your mother is breastfed too, then your great grandmother's antibodies and your great grandmother's antibodies. If a child is not breastfed at all, then probably it is cut off there. The connection is lost there. So the child is prone to more infections and she may have to fight it by her own system. That is why experts and pediatricians suggest to continue breastfeeding even when you're sick, because it can protect your baby from your current illness because of the transfer of your antibodies. You have to just make sure that you're wearing appropriate protection, such as mask and gloves, because you need not want to transfer the infection to the child. Lactobacillus reuteri is used in cancer prevention. When a mother is pregnant, around 9 months, the Lactobacillus reuteri from the mother's gut travels to the breast. There it multiplies in the breast and it's passed to the child. And this can prevent cancer up to 4 generations when the baby is breastfed from that mother. And how does it do it? The Lactobacillus reuteri is known to induce apoptosis, which means cell death. It can induce the cell death of cancer cells and it can modulate the immune system and it can do cancer prevention. Now let's explore formula. You do not have to worry about overfeeding or underfeeding as the accurate measurements are mentioned in the bottle along with how many times you have to feed. And it also aids in co-parenting. It is convenient for working parents. Special formulas are actually available for premature babies and also for babies who are allergic to milk protein, especially cow milk protein. There is a hypothesis, there is a misconception that the formula doesn't have exact nutrition or ideal nutrition as that of a breast milk, but that's not true. Optimal nutrition is present in formula, including vitamin D3. In case of breastfeeding, you have to supplement vitamin D3, whereas for formula, that is not required because it's already present. In fact, a balanced diet is given to a child every day if you're exclusively formula feeding. Now let's take a quick comparison between breast milk and formula. Nutrition wise, both are more or less same. In fact, formula is more well balanced and it's standardized, whereas breast milk is ideal and it's tailored, engineered to the baby's developing gut, as I previously mentioned. Immune support wise, breast milk offers strong support. Formula doesn't give any support, it's none. Breast milk is easily digestible, whereas formula can cause gas and colic, especially during the initial months of the baby's development. Convenience wise, breast milk is always ready, but it's a little time consuming. For formula, you can easily share the duty with somebody. Breast milk is free of cost. whereas formula is highly expensive. And in case of flexibility, mothers have limited flexibility when they are breastfeeding, and more freedom comes with the formula feeding. With this comparison, we clearly see that one exceptionally stands out, which is the breast milk, and that is because of its immune support and the digestibility. That is why WHO and UNICEF recommends to exclusively breastfeed till 6 months, and after 6 months to supplement with complementary foods and continue breastfeeding until 2 years. After 2 years, it's going to be the mother's choice. WHO actually recommends to feed even until 4 years of age. However, in some cultures, they are worried that feeding beyond 2 years can cause over-attachment issues for the child. Now, why would someone not breastfeed their baby? There are many reasons. However, I'll put three major reasons because of which mothers do not breastfeed their child: the low milk supply, the latching difficulties, and the employment challenges. Now, let's see how to balance this and still exclusively breastfeed our baby. In case your milk supply is low, you have to initiate the milk production by eating nutritious meals. This is the key. You have to consume balanced diet, especially iron rich and protein rich diet, which gives you enough calories. Stay hydrated by drinking around 8 to 10 glasses of fluids every day. And breast massages are very important. Gently compress the breast and massage your breast before feeding, after feeding, or even whenever you have time. This can trigger milk production. Now, even after eating and drinking enough, you are not getting enough milk, then you can try the empty to fill method, where you have to feed more often. Nurse your baby every 2 to 3 hours, day and night. This will empty your breast, which can trigger milk production. Pump frequently if you cannot overfeed them. You can double pump after every feed so that the breast is completely empty, and this is going to trigger the breast milk production. Do not worry about it. Or you can let the baby empty your breast. Let the baby cry a little so that you know that the breast is empty. Then you can shift to the other breast. This way, you can actually initiate or boost the breast milk production. Even if this is not working, then you can try galactagogues. These are not proven scientific facts, however. These are substances such as foods or herbs, even medications that are believed to increase breast milk production. The fenugreek, which is popular, but it can cause gas and allergies. Shatavari, which is an Ayurvedic herb and it's used traditionally, and drumstick leaves. All these are known galactagogues. However, they are just believed to increase breast milk production because of their increased calories. Sometimes doctors may prescribe domperidone and metoclopramide. These are dopamine antagonists. So they are prokinetic, which means they promote gastrointestinal movement, and antiemetic, which means they reduce nausea and vomiting. In case of breastfeeding, they are known to increase prolactin production and thereby increase the breast milk production. However, these also causes some side effects, which are extrapyramidal symptoms. It can cause muscle spasms or tremors. Hence, doctors usually do not recommend it unless it's very important. Now, there is one more thing which I want to say for increasing the breast milk production, which is get adequate rest and seek help. In some cultures, only the mother and father take care of the baby, the newborn baby. But at least three adults should be there to take care of a newborn baby along with the mother so that the mother can get enough rest. This can actually improve milk production because mother can focus on her physical and mental well-being by doing yoga or exercise, and she can manage the stress. Thereby she can actually help in breastfeeding the baby. Now, if This is not working. You cannot exclusively breastfeed, try combo feeding. If you're feeding your baby for some 6 sessions, breastfeed your baby maybe for 4 sessions, and for 2 sessions, you can use formula feeding at your convenience. If it's the latching problem, like your breast milk is fine, but the baby is not properly latching, then you can consult a pediatrician or a lactation consultant. How do you know whether the baby is latched properly? The mouth should be wide open, the lip should be flanked out, the chin should be touching your breast, and they should be rhythmically sucking. If you feel that the child is not able to suck properly, and that is the problem why the milk is not coming out, then do consult a pediatrician. The problem doesn't lie in your diet. Sometimes you might have inverted or flat nipples, and because of which a healthy child cannot latch properly. At such cases, you can use silicone based nipple correctors. This will aid in the child's latching so that the breast milk is going to flow through the nipple corrector and to the child's mouth. Now, in case you're a working mother, and that is why you cannot breastfeed exclusively, do not have to worry about it. All you need is a refrigerator. It is shown that if you pump your breast milk and store it properly in a deep freezer, which is minus 4 degrees or even colder than that, you can store it safely up to 12 months. You can even store it in the room temperature up to 4 hours and even 8 hours if it's cleanly expressed. Hence, store the milk and let someone feed the baby. So, hopefully, this video clears your confusion. Breastfeed exclusively. If can't, do a combination feeding. If your breast milk is completely limited, you're not getting any breast milk at all, then choose formula feeding exclusively. I will make the point short and clear again. Try your best to exclusively breastfeed till 6 months. Do not give up. There is a reason why the initial breast milk or the colostrum, which is loaded with antibodies and good fats and multivitamins and minerals, are known as the liquid gold.